know, as you know, it's a closed environment, so you can be really honest about the way you feel. And Jean has lived with AS for a long time, so hopefully she'll give us some insight and encouragement as we proceed through this evening. So Robin, I can't see you, but welcome, and I hope that you enjoy the evening. So Jean, if you would introduce yourself to our group, your family history, where you live, the BHD, explain who the BHD is, kids, so that we know a little bit more about who you are.
Thanks, Annie. Okay, my name is Jean Livingston. I'm 61. I live in Cape Town. Annie is my twin sister. I have another younger sister. Her name is Di. So 3 girls in a family born in Pretoria, lived in Pretoria for many years, then Johannesburg, and then immigrated to Cape Town. So I've been in Cape Town for probably
forever.
28, 30 years. So quite a long time. I've got twins. I'm a twin, obviously Annie's my twin. I'm a twin with twins. So I do remember when the gynae went and I thought there was something wrong. And he said, no, there's nothing wrong. There's 2 there. I remember thinking, oh my gosh, 1 would have been enough. But so I have twins. My daughter lives in Bali. She has 2 girls. My son lives in Melbourne and he has 2 girls. They are turning 38 in September in a month's time. So yeah, that's who I am. I'm in a finance job industry. I still work full time. So I've been diagnosed with AS since my early 30s, but I'm sure we'll get there, Annie, when you get there. But yeah, that's a little brief history of who I am.
Will you explain to us who the BHD is, and because he's in the background, and how he supports you?
So there he is in the corner of my screen. He is my husband. The BHD stands for the Baby Heart Doctor. He's a pediatric cardiologist at Christian Barnard in Cape Town. And yeah, he's an amazing support and an incredible human being. So I'm incredibly blessed to have him in my life.
That's cool. Thank you for sharing that. As a twin, I know that you said you noticed your symptoms in your early 30s, but I do remember a lot earlier than that, terrible neck pain and your professional cycling and trying to cycle with neck pain. How did you cope with that?
Well, actually, Annie, you know, it started even before the neck pain. I remember in my early 20s having Achilles tendon pain, and that wouldn't heal and wouldn't heal and wouldn't heal. And then I had a hip injury that wouldn't heal. And so they put me into hospital and to try and figure out what it was. And, you know, so all these things, you know, it's sport injuries, because as you say, I've been sporty my whole life. I'm a ballet dancer. I danced ballet until I was in my mid-20s. And then I did kind of wasn't modern, it was more a Martha Graham till I was in my mid-30s. So I've always been fit. So all these things are sports injuries. And I think one of the problems with being a sporty person, especially where there's aerobic sport, is that when you go to a doctor, they figure, well, it must be I rode from Joburg to Durban, so your Achilles tendon is because you rode too far. Or, you know, the hip injury is because you fell off your bike or you did something, you know. So there was always a sports injury until the neck, and that started. I didn't really realize that, obviously I didn't realize it was arthritis. And I remember going to a physiotherapist in my early 30s for that neck pain. And I was really active from a road cycling point of view. And she asked me to roll over on the massage bed so that she could do, and I couldn't roll over. And she said to me, this is not a sports injury. You got to see a rheumatologist this week. And it was that week, then they did the blood test and the HLA-B27 was diagnosed, and then obviously then the process starts. So I started noticing, I think in my early 20s, but I think because you're young and you're fit, it doesn't really, it's not every single day. I think that when it hits you, when you're first diagnosed, in that first period when everything is so inflamed, it shuts down. It's not just injury. My feet hurt, my hands hurt. I couldn't move, I couldn't walk. I had incredible chest pain. So it felt like I was having a heart attack in the morning. I had to get up immediately as I woke up because my rib cage used to go into a spasm. So then there's no question about the fact that it ain't a sport injury.
But at the same time, I would imagine that all of this put together, we come from a family of no blood, not sore. So you put it all together and you say, well, I've just been active. So, life's just got to go on. I know, Jean, that you've had quite a few experiences with different rheumatologists. How did you find the right person who could help you?
I think this is probably for anybody listening or watching tonight that's fairly new in the process. This is such an important question because you need somebody to walk the journey with you.
Yeah.
So you need somebody that will understand your physical journey, but also your emotional journey. So I started with one rheumatologist who is a very good rheumatologist in Cape Town, and then moved to Dr. Ingrid Lowe, who is in Panorama, and she's sporty. She's always available. She was the one who started me on a biologic. So up till that stage, I was in a very chronic scenario with sulfasalazine and methotrexate, anti-inflammatories 3 times a day, and I'd had in that particular year 3 events of uveitis. Now, if any of you ever had uveitis, it is incredibly painful, apart from the fact that it's dangerous. I saw Ingrid, and within 3 months I was on a biologic. I've not had uveitis since. I'm just saying that you need to find somebody that's happy to go the extra mile with you. I saw a beautiful post on our Facebook page this week about some professor in Joburg. Solomon, correct. And I so identified with what that patient was saying in terms of he took time. He's taken time to see where she's at. And then it's a process, because the diagnosis for me was probably 12, 13 years. Hopefully it's going to be a little bit quicker as this group becomes more active and as the information becomes more available. But yeah, I do think that you need a rheumatologist that understands where you're at and will work with you in this process, because any autoimmune disease is a daily process. It is not once a month, it is not once a year, it is not occasionally, it's continuously. And I think as I got older, so the bag of autoimmune conditions has got bigger, and I think that's really important, that you can work with somebody for a long time. Yeah, I think it's an important decision.
So really what you're saying is to really find the doctor that you, I don't want to use a cliche, but it's almost like you need to find the rheumatologist that you click with, although the rheumatologists are all very good and well trained, they might not suit your particular personality, sport abilities, etc.
I'm sporty, so I need somebody that will understand that I do need that. For me, mental health is sport. And I think that's really, yeah, I agree with you. And I think the important thing is to find somebody that you agree with. So you don't have to stay with the first rheumatologist that works that a lot of them are very good, but you don't have to stay with them if you're not happy. I do recommend that you form a relationship. I don't recommend that you hop, because I think it's really difficult for a specialist to offer you good care if you're there for short periods of time. So I don't recommend hopping, but find somebody that works.
Yes.
For you.
Well, with who you are.
Yeah.
Yes. And how do you find your everyday chores, work? How do you, what balances do you use in your daily life to cope with your AS?
Exercise is for me absolutely vital. So I work from an 8 to 5 job. So I find the mornings are really difficult, as I'm sure all the patients on this webinar will find difficult, just to get going. And that is not my preferred time. But to find a time and an exercise that works for you. So I've always said, when they diagnose you and when they give you the Humira, or when they give you the biologic that costs such a lot of money, they should actually give you a Virgin Active sponsorship as well, as part of what they pay for. Because I just think that if we're encouraged to exercise, and I'm one of the lucky ones, Annie, because for me, exercise is part of what I breathe.
It's what you enjoy.
Yes, it's what I...
If I may say so, you're a slightly addicted exercise person.
Very addicted. It's not even slightly, it's very addicted. So I do feel for people that don't love it as much as I do. So even when I'm sore and my back is sore or my hips are sore, I will still get on my bicycle or go to Pilates. By the way, I just discovered the Pilates 2 years ago. I can encourage you all. It is the miracle worker for AS. It's been amazing for me. So if you have the opportunity, but get to somebody who understands it. But yes, so
yes.
From a day-to-day point of view, I think that exercise is important. I try not to sit for too long at my chair. I'm not very good at it, because I do sit and get involved in what I'm doing, and then I don't get up and walk around, but that is important. What you eat, I think, is important. I think keeping your weight as well balanced as you possibly can, depending on what challenges you're facing. But I think eating is important. Eating regularly is important. But from a day-to-day point of view, I'd say exercise is probably pain-wise my
yes. And how do you balance your exercise, work, sleep routine at weekends? During the week, how do you balance that?
I don't really, Annie, if I have to be really honest.
That's true. Yes, you don't.
I don't really. And I mean, I would imagine there are other people here that will identify with what I'm saying. It's really hard when you have an autoimmune disease, and you're working all day, and you might have young kids, or you might have a young family. You don't really score first dibs at
priority.
No. So to be honest with you, the balance is an ongoing journey. At 61,
yes.
I got it right. But I do think we should try and get, I'm great at giving advice. I'm really bad at taking my own advice. But yeah, so I don't always balance it as well as I should. As long
but
as
it sounds like, Janine, that you mentally are able to switch to what I need to do, what I don't need to do. Have you got any tips for us on how you do that? Candace, we can see your floor. It's really sexy.
Hi, Candace. I think, Annie, excuse me, my nose is running. It's cold in Cape Town. The tips that I would have would be perhaps to write a goal list. And the goal list could be read my book for 15 minutes a day, or if I've also done some quiet time kind of with myself, also not good at it regularly, but if you write yourself a list of things that you can do, that's possibly a way of managing it. Tips wise, I think, to be honest, I'm a bit of a bull in a china shop. I just hope.
Push.
I just push through as much as I can and do as much as I can and try and live as normal life as I possibly can. There are times, I mean, I think there are times for all of us that we just melt down. It's just time out.
So you're saying, though, that perhaps that's part of your goal, is to somehow be able to say there are going to be days when I'm not going to be able to achieve what I feel I'd like to achieve in every day.
You know, I remember Dr. Ingrid Lowe saying to me not so long ago, you know, one of the challenges she sees with me is that I haven't accepted that my body has changed. So all of you younger AS or other autoimmune issues is to work on the acceptance. What Annie has said is so important. If you can accept that there will be times that I need time out, and there will be times that I can't do what I used to be able to do with the energy that I think the stress levels will be less, because I think that one of the things, Annie, with the change in one's body comes the change in one's anxiety or level of good energy and the mental well-being. And I think that anxiety and depression and just a lack of ease sometimes, particularly when you feel like you're not achieving the goals that you would have been able to do, that I was able to do in my youth, that I can't anymore. And it's not anymore a situation where sometimes I can't push through. Sometimes I actually can't.
And that's absolutely okay.
Well, it is okay, except sometimes I can't get it from here to here. And that's the stress level that I think that our patients, certainly when I'm reading our Facebook things, some of the frustration levels, I mean, I think there's a positivity there that's amazing, but I do sometimes see an underlying, sometimes, oh, you know, I'm over it today. I want to get off the bus. Can I just have a day off? And that should be okay. And I think it's one of the things that perhaps we should recognize earlier on in the disease so that we can come to terms with it. So if you're in your 20s or 30s, it should be something addressed early. So that it's not, so that you live with it more peacefully, really.
Yes. So I think what Lauren was saying, that self-compassion is so important. It's somehow we have to get from our head to our hearts the reality that we're doing our best.
Absolutely. And you know, I think that for most of us, our best is actually plenty good enough. Yes. You know, so what's wrong with us? Why don't we say it's plenty good enough? So there's this kind of like excuse that you got to be better because you're battling with it. So, you know, I really got to hold it together today, you know. And I think that that's self-compassion is, and it's not just with AS. I think that generally our culture really doesn't allow for self-compassion that much. So I don't think it's only autoimmune patients. I think it's probably general population. But yeah, it's important.
The frustration that we're not an astronaut and a brain surgeon and a pediatric cardiologist and a physiotherapist and a perfect person and mother and all the rest put together. Yeah.
There's a doctor at the Red Cross Children's Hospital who runs the rheumatology department at the Red Cross Christian Hospital who has AS. So I think that, you know, because you have AS doesn't define who you can be. Yes. And I love that. It doesn't define your limitations. So I think, if we, you know, you talk about the balance and the compassion. So if we can perhaps say, like, I had a really bad migraine today. It's okay. Just put the day behind you, but tomorrow is still going to be a good day and it's okay. So this particular doctor is, I haven't met him, but apparently he's an amazing human being, and he has AS, and he is on a biologic. So we're not limited. we're frustrated, but we're not limited.
That's very encouraging, because although we have to redefine perhaps what we do, which would be different from what we did 10 years or 15 years ago, the fact that it doesn't define us means that we can be creative about our future and our goals, and
shouldn't limit our goals. If you want to be a pediatric cardiologist, do it.
Yeah,
I think that physically, the challenge is physically. So if you want to be an Olympic swimmer or runner, you're going to have a challenge.
Maybe, yes.
Find something else.
Yes. So one of the things I wanted to ask you, because I know that I've experienced this, and I'm sure the other people with us tonight have experienced as well. When somebody says to you, well, just change your diet, or I'm going to suggest whatever therapy, yes, whatever, but seriously, just have a good night or pray about it. How do you deal with that?
You see, I deal with it in two ways. If I'm not on Zoom, then I don't roll my eyes. I mean, if I am on Zoom, I don't roll my eyes. If I'm not on Zoom, I roll my eyes, and I just hold it, sis, because people don't understand that we are way past the panado. So it's gone.
And a good night's sleep.
No, and a good night's sleep. What is a good night's sleep? Like, how many nights good night's sleep do you get?
The good night's sleep is how many times you woke up because something was sore and you had to move.
Correct. So I really think that people don't understand, and I think they mean well. I really think that people earn the right to. So strangers I find a little bit annoying, but my close friends that feel that they have the right homeopathic remedy to solve the problem, I kind of allow it, because they mean well. And,
yes.
There are a lot of homeopathic remedies that may assist with the medication.
The symptom.
Correct. So I don't think we should blow it all out of the baby's bathwater, because I think that there's a definite place for it. I mean, if you look at some of the vitamins, not all of them, I think we need to be careful of that, because it's a huge industry, multi-billion-dollar industry worldwide. So I think one's got to be careful with that. But I do think that we should just let them say their thing and roll your eyes if they're not watching.
And let it pretty much wash
go,
off your...
because, they don't. It's very difficult to understand.
Yes. I was explaining to somebody the other day the anxiety that I sometimes feel when I have a migraine and I'm really, really battling to cope, and there's stress and there's stuff that's got to be done. And I sort of explained, I've got 25 balls in the air, but I'm not quite sure where they are. And I know that one of them is going to come down and hit my head, but I'm not sure which one it is. And I'm trying to count them. So perhaps maybe explaining some of the symptoms in a way that other people would understand.
Yeah.
Maybe we have to be more creative about explaining, but I do agree that it's very difficult.
And I certainly find making a list on those days, so whether it's a migraine or whether it's another day, is to make the list, and often when you make a list of things that need
good point, yes,
and you tick them off, you actually find it's not as big of an issue. So some stuff has to get done today, some stuff can go for tomorrow. So making that list certainly helps me put some of that anxiety, the A personality.
And most things are not going to kill you if you don't do them.
No, I mean, we've got so used to having instant contact, instant reply, instant communication. So I think sometimes we need to actually allow ourselves, get up, go for a walk, around your building, around your office, or around where it is, and just take a deep breath, or go make a cup of tea and drink it, and don't take it all. I think that those are the important things. I'm hell of a good at giving advice. I'm not good at taking it. But yes, occasionally when I do that, it really does help.
So what you're really saying is, in a way, we have to be intentional about the breaks and the spaces that allow us to cope with the day that is busy, hectic, and full of demands.
I think particularly with an autoimmune disease, if you don't have an intent, and that's what I'm saying is write the goals or write the list. If we don't have an intent to take time out for ourselves, you will have a day or two or a week or whatever that you won't cope. And unfortunately, when you're not coping, then the anxiety comes, because you know you should be coping, you know you should be doing your kids' homework, you know you should be doing this for them or that for them, and why didn't you do it? And then you get to sleep and then, oh, so I should have done it. If you don't set those boundaries early on, and remember that I'm way over, a lot older than some of our patients online, I've kind of learned that if I don't set those boundaries, I really am no good to myself. And if you're no good to yourself, you're no good to your family either. So,
John, would you explain humiritis to our group, and how you and I talk about humiritis? Hi, Candice, we can see you at last.
Nice to see your face. So Annie, I started Humira many years before Annie did. I had to nag her for a long time to get it. And for all of those of you who are on probably any biologic, Humiritis is the day or 2 or 3 after you've taken your injection. So then comes the sore throat, the fatigue, the possible headache, and you think, oh my gosh, I'm getting a cold or something. And actually it's not, it's just a Humiritis. And sometimes I breathe my Humira injection, and sometimes I absolutely don't. So for all of those of you who's starting new, yes, and then I'll phone Annie and say, oh, jeepers.
I've got Humiritis.
Yes, exactly. So find somebody that you can
yes,
that you can say, jeepers, today it's, because often you don't have the opportunity to lie on the couch all day. You've got stuff to do. So the Humiritis can be frustrating, but yeah, it's those couple of days depending on how you react.
So it's really to find somebody who will laugh, cry, just really walk and understand where you're at in your whole biologic journey, isn't it?
It is. And, I think that we are so lucky. And I think that this group is becoming more and more active in terms of the questions that are being asked. I've noticed a lot of the questions are not, just I'm having a bad day today. It's, has anybody else experienced this symptom? And a lot of them have been answered by, yes, I have, this is what I've done, this is what's helped, the physiotherapy or the gym. Alice is in the gym. I think she's got things behind her that look like Virgin Active gym things. These are the things that help. If we have a place to go to where it's a safe place where other people understand, and it shouldn't be a place where we can do a pity party, because I think that's what you're going
we don't need that.
We don't need that. But if you have and there are a lot of questions that I think have been fabulous in terms of, does anybody have this experience? Would you have a suggestion of where I can go or what I can do? I think it's very lucky.
Lauren is asking the question, is Humiritis a twin-created word or a medical condition?
No, it is purely a twin-related word, but you're welcome to take it on.
So whatever medication you use, you can make it an itis word. It just helps to I don't need sympathy. I just want you to know that I'm having a humioritis day, or an embryonitis day, or
and you know what I mean when I'm saying I'm having a humioritis day.
Yes. It's a good giggle rather than anything that's definitely not a medical symptom. So, Johnny, are there any questions, perhaps, guys, that you would like to ask Jean while we're?
I hope that there are some new. I can only see Lorraine, Nell, and Candace. So I don't know who's on Facebook, but I know that there've been quite a few questions about. I'm about to start a biologic. What can I expect? It took me. I was off my bike for about 10 months before I actually was able to get onto my road bike again. From I was a competitive rider before that. And then it was about 9-10 months before I got back on my bike. And then I had to join the beginner group because my rib cage was so sore, I couldn't actually breathe. So for those of you who are starting, I don't know if there are people here with questions that are starting, but I've seen that a couple of times. It can take some time. Annie was a lot quicker than I was. But yeah, if there are any questions, I'm very happy to take them.
Are there any questions, Lauren, that we need to cover?
I don't see any questions yet, but if you'd like to come off of mute and share your question or post the questions in the chat, either on Zoom or on Facebook, let me know and we'll get to your questions. But I think that's it's a lovely question that you're asking people too, of like, where are they in the journey? I know we have some older members and some new members with us today. And we really like to hear where you're at in the journey and how it's been for you.
That would be great.
Yeah. I've just started co-syntax, Candace, and experienced the itis. Yes! So it's co-syntax itis. Isn't it fantastic to know that there are people that understand the itis bit?
Yeah, well, I wish you luck. That's one of the newer biologics. I've been on it for so long, but what are your symptoms, Candace, on this biologic?
You have to come back.
Hi there.
Hi.
Hi. So I've just recently started on Consentix. Previously was on Symphony. And Symphony just wasn't working for me. The 2 doses of Consentix was great. And then the third one kind of just really knocked me out completely. So I had body aches, flu-like symptoms, still struggling with a cough. And the strange thing is that as I work in theatre, and one day you look so fantastic, and then the next day you don't, and people they just don't understand. But what did you do? And they really don't understand that your body is trying to cope with so many things. Be it the work stresses. In your mind, you're telling yourself, I need to be active, I need to be active. Right. But yes, like you said, there needs to be moments of really being mindful and saying, you know what, I think I've got to rest, and let me do as little as possible to get myself back into the momentum of where I would like to be. And I hope Consentix is able to actually assist me in this walk, because I really need it.
Thank you for sharing that, Candace.
Thank you so much. I think one of the challenges of the biologic, and it's a life-changing experience, certainly that I've experienced, but as a theatre sister, I would imagine that you're an A personality type, because that's not an environment for sissies. So it's so hard that day that you go back and you're not feeling great to say,
and you've got to stand forever.
Yeah, and to say, I'm not feeling myself today. It's really difficult. So, we admire you for having it there, and perhaps maybe suggest to your colleagues is to say, listen, I've just started this new medical
Biologic.
And I am going to have those days, and hope some of them will understand, some won't ever, but hopefully they'll give you the space to say, Candace is having one of her days, let's bring her a cup of tea. That would be so nice.
That would be nice.
Well done.
But Candace, you know what? We understand the itis bit. So if you don't get any understanding in theatre, you just have to put it on the Facebook group, and we'll itis sympathize.
Yeah, no, I'm all there for the support. I think
that's good.
I think that it's been
but
such
I don't see a name. Have you got the name there, Lauren? There was somebody's hand up.
It was Lauren.
Lauren, what was your question? Oh, I don't know.
Lauren, you're still on mute? Just put it in the chat box if you'd like to. I'd just like to, we normally have about 30 minutes odd during this patient time. And I just want to say thank you to my precious.
There, Annie.
Lauren, what would you like? Yes, please say. Yes.
Are you talking to me, Lorraine?
Yes, Lorraine, we're talking to you. Go for it.
I was diagnosed in end of April, and I couldn't find anything so far yet to help me. And I am on an itis tonight. And,
you're on an itis experience.
Well, I won. And so far, I can't use any anti-inflammatories. I'm very allergic and very sensitive to all the medications so far. So at the moment, I'm on nothing, and yeah, I'm a little bit desperate, really not feeling well, and really new into this. Have you got advice? And then the
Lauren.
other thing is,
yes, carry on.
The other thing is, I went to a physiotherapist for a few times, and then things just went too bad. Which is the best thing to start with a normal physiotherapist, or what would you prefer?
I think it's important for you to realize that we're all patients, we're not doctors. So any advice that we give you is itis advice. Jean, what advice would you give Lauren?
You know, if you're allergic, are you allergic to painkillers as well, Lorraine?
I can use Sinaleve, but I've got stomach problems as well. So I prefer not to use them.
Okay, I think that you need to accept, Lorraine, that you will need to use the painkillers, and ask your rheumatologist for a stomach protector. So there are quite a few drugs that you can use that will protect your stomach as much as possible from these drugs. But unfortunately, I just don't know how I would have coped without them. So trying to find something that will at least take the edge off. Physiotherapy has worked for a lot of people. Aqua aerobics or aqua swimming or something like that, where there's no weight on the body. But my recommendation is to try and find a biokineticist perhaps that has an interest in these kind of inflammatory diseases, that could work with you, possibly in a pool or possibly outside of a pool, but just to mobilize. But this is unfortunately not an easy disease to do without assistance. So keep looking, and
we're here for you.
Yeah, keep trying different things. Ask your rheumatologist to try and recommend different drugs to see if there isn't something. Have you tried methotrexate?
I started on methotrexate. I was on Humira. I've been on quite a few, and the last one was the Humira injection. And within 2 hours, I had very bad complications.
Oh, boy.
Okay.
Yes.
You know,
Well,
unfortunately, we can't give you advice on medical condition and medical stuff because we're all patients here. But I think what Jean is saying is so important that you speak to your rheumatologist, find a rheumatologist who's going to walk the journey with you, because it's not a one size fits all patients, and each one of us is at a different place in our journey. But I just wanted to say thank you, Jean, so much for your excitement, your encouragement.
Thank you for having me.
You're so welcome. I'm very privileged to have you as a twin, and I'm going to say that in front of everybody because I love you madly. And our ITIS experiences always bring us the giggles. So, Candice, we expect an ITIS WhatsApp or Facebook.
She's got itis today.
Yes, yes. So, yeah. Thank you, everybody, for attending. I really appreciate it. And
Hang on
yeah,
a second.
thank you.
Hang on a second. Do we have 2 minutes?
Yes.
There's a question, how do you change your mind shift from I am not good enough to I am enough? That is a constant, absolutely constant daily journey. And I am always good enough when I'm having a good day, and I'm always really not good enough when I'm having a bad day. It is a journey, and it's something that also needs to be addressed. Don't be scared to ask for help. Don't be scared of the antidepressant if it gets too much. It's okay. This is not an easy journey. So if that helps you, then that's fine. But do it with your rheumatologist so that it's not, so don't self-medicate. Do it with help. But yes, that's an enormous question and impossible to really, except some days I really feel, yes, I did it. And that's often enough to see me through most of the days that aren't. Candice has just said that a physio can assist with your current issues and assess how you're compensating with other muscles that you're being loaded whilst you're in pain. I think that that's a really good point, Candice, is that find a physiotherapist that understands, and most of them do, and go for it. It's worth. It's
almost like you need a complementary assistance. And what I enjoy about the Facebook group is that we can share experiences. And yeah, thank you, Candice, for that. Really appreciate it. Lauren, do you want to close for us, please?
Yes, of course. Thank you so much for a wonderful discussion, the both of you. I feel like I've been able to experience the twin energy, and there's definitely lovely energy between you two. And thank you for sharing it with the group. And for you, Jean, for sharing your experiences and your wisdom after so many years with this condition. We really appreciate you coming on here. And Annie, thank you so much for being a wonderful host. It's always a
You're welcome.
delight to work alongside you. And thank you everyone who's listening. If there are any comments, questions, please continue to put them in the chat box. This recording will go live, will stay on our Facebook group, and you can watch it there and comment there too. And we'll end up putting this recording also on our website. So thank you for joining us. We look forward to seeing you at the next one. Annie, when is it?
That is David, and he's going to be talking to us on the 22nd of September.
Brilliant. So the 22nd of September, Annie will be back with us in the same space. So yeah, diarize that, put it in your calendar, and we look forward to seeing you.
Get your questions ready.
Yeah, exactly. Brilliant. Thank you, everyone.
Thank you so much, guys. Thank you. Candice, I expect the ITIS soon. Lots of love.
Bye.
Bye.
Bye.